We're back at the Last Visit First podcast, live from Scottsdale, Arizona. My buddy Kurt Baumgartel is here with us. Kurt, what are you doing these days?
Well, I'm the CEO of CareRing Health. So we're a mid-Atlantic based home health business, mainly personal care, but we do personal care, home health, hospice with the goal of really providing a differentiated care experience for dual eligibles.
Yeah.
So really perfecting a model to wrap around the services of personal care, home health, and hospice.
So Kurt and I have known each other for many, many, many years. He's was at Celtic, and then he was at Evolution. We partnered together there. He went to Capasys. And now he's over here, CEO running the business. So it's pretty cool. You're at Home Care 100. Anything new and exciting you've done while you're here?
Yeah, lots of networking. Good to reconnect with old friends and peers, yourself included, and really to just get an update on what's happening in the industry. Probably one of the things I'm most excited about on the tech front is, ambient AI, ambient listening for our clinicians. I was 3 years in the physical therapy space, and we implemented that tool with our therapists, and it was a game changer. So I'm really excited to see what that can do for our skilled clinicians.
So let's unpack that a lot, because everybody here is talking about this.
Yeah.
So you're talking about like companies that are listening to a nursing visit in the home and figuring out how to do the documentation automatically through that, what it learns in that visit. You were doing this in the clinic.
We were doing it in the clinic, yes.
So you're in a clinic with connected Wi-Fi. It works really well. Therapist goes in, sees the patient. We're doing a get up and go. We're doing ABC test. They're doing physical assessment. They're looking at Nana. They're watching her gait. They're talking to her. They're doing her medications, all that, and it's filling out the whole form.
It's filling out the whole form.
Holy
yeah.
crap.
So it listens to the conversation. And in a physical therapy clinic, it's busy, it's loud, there's lots of noise. You usually have multiple patients working at the same time, and there's prompting that can allow you to let the AI know, okay, I'm now with Mr. Maxwell versus Mr. Baumgartel. So it'll pick up where you left off. You can use it. We were using laptops on carts, or what our clinicians use, but there's apps on their iPhones or iPad. So it really changed the game for them. We had people in tears just because happy tears because it saved them so much time.
We were talking about this last night. So Kurt it's pretty amazing. We're going to fix this.
Yeah.
I have a bunch of money that I wanted to invest in these companies, and I've been talking to a whole bunch of them. I've spent the last 7-8 months doing it. Somebody's going to come out with the right tools here, and you guys probably heard me on stage yesterday talking about we have to figure out how to make a nurse want to do a start of care versus have to do a start of care.
That's right.
Today, most nurses run from start of cares because they don't like it. They get judged on it. It takes forever. It's not worth the amount of points they get, not worth the time and money. If we solve this problem, we'll solve home health problems, in my opinion.
I couldn't agree more. And when I was in the outpatient world, seeing these tools, we were an early adopter of them. All I kept thinking about is this would transform home health.
It will. In home
and
care
so I
and
can't
hospice.
wait. It'll transform. It's transforming healthcare. Physicians are embracing it. So to me, when people ask me, where do you think AI is going to impact healthcare, I think that's one of the easiest use cases that'll help everyone.
All right. Tell me more about your business.
Yeah.
I love that. So where are you guys at? How many patients?
Yeah. So we've got 5,000 patients and clients on service. We're in 6 states, mainly in the mid-Atlantic. 80% of our business right now is personal care. And then, the rest is skilled home health with a little bit of hospice. But what we're really working on perfecting in the Philadelphia market is a care coordination model. So the team's done a really nice job of pulling data from all of our EMRs into we have a Snowflake database. We put Health Cloud on top of it with various workflows, not just for like intake management and other things within the business, but also for our care coordination efforts.
That's awesome.
Yeah. So it's so just trying to get the people and process side of it down now, and really like identifying personal care patients that need, or clients, that could benefit from skilled home health, and then certainly, obviously, hospice care. And we've shown already last year, 75% of our patients in our catchment area in Philadelphia had a need for other services, and a third of those we actually admitted to other services. So it definitely works. Now we need to prove the outcomes, and hopefully get a demonstration or a pilot with a payer in that market to prove the cost savings for dual eligibles.
Are you talking to Brian Lobley at Tango?
I am.
Good.
Yeah.
Yeah. I'm an investor in Tango, so that's why I'm going to plug them, but that's right up your alley. Right?
Yeah.
Working on
He and I actually talked at your place the other day.
Okay, good.
So
That's
yeah,
good.
we're going to get together up there.
Yeah, he's a Philly guy too.
He is.
Are you still living in Tennessee or you live in Philly?
I'm in Nashville, but I'm in Philly a lot.
You're commuting to Philly?
Yeah.
I used to do that commute when I was within Clara.
Yeah.
It's a fun town.
Yeah.
It was a lot more fun before COVID, but yeah.
Yeah.
Just don't become an Eagles fan.
No. I'm a struggling Steelers fan right now.
Wow.
Yeah.
Wow, that's even worse. I'm a Cowboy fan. It's the worst thing ever.
Yeah, you're kind of used to it. But,
yeah. What if somebody wants to get a hold of you? How do they get a hold of you?
Yeah, so they can email me at kurt.baumgartel@caringhealth.com.
Okay, or they can go to your website.
Or they can go to my website and they'll get a hold of me.
CareRing Health there. We'll post it out in the show notes and your LinkedIn as well. But yeah, I'm really excited what you're doing. Thanks for being here.
Thanks for having me, Tom.
All right, talk to you.